Knock, knock. Hi, my name is Sarah. I'm going to be your nurse today. I'm going to provide for privacy and wash my hands as I enter the room. Can I get your name and date of birth, please? And he tells me his name is Ron Smith, date of birth 2/19/1955. Everything matches. Do you have any allergies? And he says yes, he's allergic to morphine, and that's what it says in the chart. So today I have an order to give you some lorazepam for your anxiety. I know you've had this medication before. Do you have any questions or concerns? And he says no. I'm going to be administering the medication through your PICC line, so right away I'm going to assess the site. I don't see any redness, swelling, edema, or anything like that, so we look good. Have you had any pain or discomfort in your arm at all? And he says no. Okay, so I have my supplies. I have my 3 syringes with normal saline, my medication, my vial access device, my MAR, alcohol pads, and my Betty book that I will look up to see if the medication is compatible with normal saline, which I'm going to dilute it with. And then I'm going to check the rate to give the medication for. So it says that I've already done the math and I am giving 1.5 milliliters, and I can give that over 30 seconds because it's 2 milligrams over 1 minute and the order is for 1 milligram. And it is compatible with normal saline. So give that over 30 seconds. So first I'm going to make sure that none of my syringes are expired or my medication, and my medication and syringes all expire in 2030, so we'll be good with that. I'm going to label my syringe with my, I have my label ready to label my syringe that I put my medication in when I do. I'm going to make sure I get my medication dose accurate. There's no air bubbles in it. So I'm at 1.5 milliliters of lorazepam. Okay, so I have lorazepam, 1 milligram IV push every 4 hours, PRN for anxiety for Ron Smith, and I'm giving that through his PICC line right now. I have lorazepam, 1 milligram IV push every 4 hours, PRN for anxiety, given to Ron Smith right now. And checking his name again. I have lorazepam, 1 milligram IV push every 4 hours for anxiety, due right now for Ron Smith. And I'm not giving anything that he's allergic to. He's a full code. Everything matches. So now I can dilute the medication into my syringe. Some agencies would require that I would also have a heparin flush, but we don't need that right now. And I can dispose of this in the sharps container. Make sure that I don't get any air without wasting any medication. So we're good there. And then I'll put my label on to make sure that I know which one is the medication. Okay. So I'll wash my hands again. Put on my clean gloves. And then before I would give the medication, I would assess like baseline vital signs and a baseline assessment of how he was overall doing, just so that when I gave the med, I could assess for any adverse effects. So this is my medication, and then I have my 2 flushes. So first I'll clean the port for 15 to 30 seconds. There's no air in this one, so I'm good to go. And I'll push. And it's going in smoothly, so I don't have to worry about the line being occluded or anything. And then I have my medication that I have labeled with my syringe, so I know that's the right one. I'll clean it again. 15 to 30 seconds. And then this one I'll push over 30 seconds. So I'm watching the clock for my watch. For lifespan considerations, for example, pediatric patients may not get the same dosage as an adult, so you just want to make sure that you're always double checking the book and making sure that your order matches the correct dosage for that age and possibly weight of the client too. So it's been 30 seconds. And I have one more flush, and for this flush I want to start by giving it at the same rate as my medication was given, just so I don't push any medication into the vein too quickly. And then I will use a pulsing technique since it's a PICC line. So I'll start slow, going for 30 seconds. And I'll do the pulsing technique. Are you doing okay? And he says he's doing fine. So I'll take my gloves off, wash my hands, clean up all of my stuff. Then I'll do an initial assessment following the medication, and I'll follow up on his anxiety, see if he's doing better, take some vitals again, make sure he's not having any adverse reactions. Then I'll document the time I gave the medication, the dose, the route, and how the patient tolerated it.